Are you ready for a powerful new way to learn occupational medicine? Our training program blends skill, practicality, encouragement, and camaraderie all into one. We present engaging content that's straight to the point, no fluff, directly from occupational medicine experts. Welcome to Ascend's Occupational Medicine Training Program, where we make workers' compensation fun and enjoyable to learn. We help your providers master occupational medicine principles so your clinic can successfully care for injured workers and navigate the workers' compensation system, attainable only through Ascend's exclusive occupational medicine training program. There are millions of dollars at stake in lost revenue when your clinic doesn't have a reputation for getting workers back to work as soon as possible, managing complex cases with ease, and having providers who understand the dance between serving the worker and serving the employer. There are multiple hours lost every week as providers try to figure out workers' compensation and how to navigate the system, which honestly isn't hard. Providers feel a loss of power, not knowing how to effectively care for injured workers. They feel kind of crazy because they aren't exactly sure how to manage cases, especially the challenging cases that involve multiple body parts and specialists. They're frustrated that they're being asked to do a job with no real guidance. Ascend will teach your providers with lessons that are straightforward and compelling. Your providers can listen during their commute to work. We'll walk them through difficult cases. We won't cram more into their schedule, and before you know it, they will be exceptionally trained and able to handle anything workers' compensation throws at them. One of the clinics we trained had a mix of doctors, physician's assistants, and nurse practitioners. None of them had been classically trained in occupational medicine, but we trained them with engaging, practical content so they felt more knowledgeable and confident about how to care for injured workers. They began closing their workers' comp cases faster than ever before.
In October, I went to the OMED conference, and I've been going to these for 20 years. And the best lecture of that conference was, in a shocking turn of events, a work comp lecture, which I couldn't believe, and whenever I get to go to a lecture like that, I always, I try to go up to the person afterwards and just thank them for their lecture. And I went up and introduced myself, and we started talking. We hit it off right away. And, I said to her, you view work comp in a totally different way than anybody I've ever met. And you're the first person who, when you talk about work comp, you don't want to kind of gag in your mouth a little bit, or throw up a little in your mouth. She really looks at it in a totally different way. And I said, you could really change the world, Leslie, by doing what you're doing. And she said, well, as a matter of fact, I do. And she does lecture around the world, and she does do that very much. But I just, fell in love with her and think she's, the cat's meow.
If you've looked for workers' compensation training in the past and haven't been successful, it's not your fault. There aren't a lot of training programs out there for providers who are in the trenches of workers' compensation. For many providers, occupational medicine residency isn't an option, and there certainly aren't programs that teach you all of the nuances of the field, like what do you do when you think a worker is faking their injury to get time off of work. Ascend's distinctive program covers it all. It's a brand new way of getting occupational medicine expertise. According to the Association of American Medical Colleges, as of 2021, there were 238,983 active internal and family medicine physicians. Only a percentage of them see workers' compensation patients, and most did not receive additional training in occupational medicine. Comparatively, there are roughly 2,000 specialty-trained occupational medicine physicians in the U.S. You're either in this small group of classically trained providers or you're not. But the thing is, the U.S. has a working population of 129 million full-time workers. Who is taking care of all of these people? You guessed it. Most occupational medicine visits are managed by PAs and NPs. They're doing the majority of the work. How can the majority of the medical team not be included in the highest levels of training? That ends today. Occupational medicine physicians with access to formal residency training can't be the only ones who get the goodies. That's why Ascend has made it our mission to train all providers to deliver the best care to injured workers. My name is Dr. Leslie Cadet, and I started my occupational medicine career in 2013 as a flight surgeon in the U.S. Air Force. I cared for pilots and aircrew in the finest military in the world and ensured they were fit to fly. I also cared for their family members. I was literally the team doc and the family doc. Eventually, I got so good at being a flight surgeon that I served as the medical director of the clinic where I was assigned and began training other flight surgeons how to be amazing too. I had the honor of being named Flight Surgeon of the Year out of 11 different Air Force bases. I transitioned to civilian life and led my residency class as chief resident at an Ivy League occupational and environmental medicine program. Once I graduated, I joined academia and started training civilian doctors how to do occupational medicine as a part of an accredited residency program. My residents keep naming me Teacher of the Year, year after year. I speak at multiple national conferences, sharing my expertise with the leading organizations for physicians, PAs, and NPs. Teaching and training is my thing. Check out what our clients are saying.
I am Justine, and I am the Director of Ambulatory Care and Community Affairs at Western Missouri Medical Center, and I run our occupational health program. And I have been nothing but happy with working with Dr. Cadet. We've worked together for about 2 months. I initially saw her speak at a conference and was immediately intrigued by her enthusiasm and how well-spoken she was and how educated she seemed on the topics. And so I reached out to see if she would mind doing some education for some providers that I don't have that aren't super experienced in OC Health. Her videos are short, sweet, to the point. They always provide printouts with topics and education and specific information on releasing patients and exactly what she has just talked about. On top of the educations being perfect for our providers who are busy people, she also is super, super, super easy to get a hold of. I've got her cell phone number. I've got her email address. I have never one time reached out to her and it been more than 24 hours before I got a response. If we have website issues or email concerns or something that's not going right, she is on top of it, always gets it taken care of, super attentive. I have just been super, super, super happy with everything that we have gone through thus far, and I'm excited to continue our relationship.
If you were to pay cash for your providers to attend medical school and then complete a top-rated occupational medicine residency, the cost would be easily more than $540,000. Imagine paying that amount for each of your providers. Our 1-year cutting-edge training program is available to you for much, much less. In addition, your clinic will receive these bonuses: free copies of our book, Managing Worker Expectations of the Return to Work Timeline for all of your providers, work restriction templates organized by body part, group coaching calls, an inquiry portal to ask an unlimited number of questions, peer-to-peer phone consults, and mentorship and strategic advising for clinic leadership, along with access to a video library of all of our national conference talks. You know how tough it can be to manage workers' comp cases, especially when your providers aren't really sure what to do. You can see your staff struggling, wishing someone would simply explain what the steps are without all of the convoluted monologues. Now, it's time for a discussion. The way I see it, you have 3 options. Option number 1, do absolutely nothing and stay exactly where you are right now. If you and your clinic are muddling through just fine, then maybe you don't need our training program. But if you'd like to improve the occupational medicine experience for your providers, give your patients a better worker care experience, build alliances with local employers, and boost your revenue, that leaves you with 2 other options. Number 2, you can do it yourself. You can put some worksheets together on your own using Microsoft Word, then Google the rest and hope to come up with something that will help your providers gain the skills and confidence they need. Although realistically, if you could have done it yourself, you already would have. And then option number 3, let Ascend do the heavy lifting for you. We'll put our proven training system to work for you. We will work with your providers to build their occupational medicine expertise. All you need to do is register your clinic, Then sit back and watch your providers grow. Of these three options, ask yourself, what is going to be easier for you and more beneficial for your providers? You see, there are two types of people in this world, leaders and followers. Those who complain about the way that things are, and those who are ready to take action when the opportunity presents itself. Most clinics will tell you that they want more training for their providers, but we both know that very few will actually make it happen. It's human nature. The classic tale of the wishers and the doers. Most will keep wishing, while the few that are actually serious about providing the best clinical services and having the best trained staff will take action. Since you've listened to my entire presentation this far, I think you are one of the special ones. One of the nation's few practices that actually want to be the best. If I'm right and you're still with me, I'm ready to set up a call with you so that we can get your clinic registered and start training now. Only you can decide. Use the link below to schedule your call today.